Yeah.
Absolutely. You have to be strategic and less tactical, right? It's not about at elbow fixing one-on-one issues. It's truly being strategic and looking at how do I put up this healthcare OS
Yep.
and integrate that into the care delivery. For me, I was in a unique position. I was also vice chair of medicine. So I
Mm.
made sure that I understood when I'm recruiting primary care doctors, which is very hard, that if you think about future practice development and design, how about if I had providers work 2 days at home and do population health management and 3 days in the office? That's much better work-life balance. Number two, I can actually incorporate quality as a higher percentage of their revenue instead of the hamster wheel fee-for-service world,
Yep.
right? Incorporating that piece of it. And then providing them the data so that they can actually then make sure the A1C scores and blood pressure and all those things are good. So transformation is not just a digital one. You have to transform clinical operations as well. And that person should be able to partner with a chair department or the CMO or CCO to be able to make sure that they are in total lockstep
Yep.
in that strategy, right? So that's one of the key things. And if you do it right, you can recruit more providers, you can retain them,
Yep.
you can actually see more people, you can actually bring in more revenue. It's all there for the taking. But
Hmm.
we have to fundamentally change how we think. And most health systems, especially big IDNs, they're very siloed in their governance structure. And so they really need to, instead of thinking of it more enterprise wide, they're thinking about this medical group in this region versus this medical group in another region versus this hospital in this region.
Mm.
And that's just not the way it needs to work. Every hospital should be connected. Every clinic should be connected. So when a patient transitions out of hospital, they have a medical home to go to, either virtually or in person.